The functional gait assessment is an outcome measure useful in older adults, patients with vestibular disorders, Parkinson's disease, and stroke recovery. The functional gait assessment is a modification of the dynamic gait index. The DGI actually includes an additional component, stepping around obstacles, but the FGA includes all of the 7 remaining components of the DGI, plus the assessment of the narrow base of support, which is in tandem walking, backwards ambulation, and walking with your eyes closed. One might choose the FGA over the DGI if you suspect your patient has vestibular dysfunction, and it might help you narrow down the source of their chief complaints, as the FGA was created to eliminate the ceiling effect of the DGI, which was stated on the FGA webpage under SRA Lab. You might also choose to use this measure over the Berg balance test if your patient is further along in their rehab and needs to work on their dynamic balance rather than their static balance, or if you're trying to determine vestibular involvement. Initial setup of the test includes measurement of the walkway, which was placing tape as distance markers. So the walkway measures 20 feet by 12 inches wide, and I was using my watch to time the patient, and I had a gait belt on her to ensure patient safety. The patient was also wearing comfortable shoes, and the pathway was cleared beforehand, before testing. The test is scored 0 to 3 for each component, with 3 being normal ambulation, in which the patient has no gait or balance impairment and completes the test in a timely fashion. A 0 would indicate severe impairment, where the patient uses increased time, deviates from the 12-inch runway, or needs assistance to maintain their balance. There's a total of 30 possible points, and the test can be performed with or without an assistive device, but this would just have to be documented if one was used. And as far as norms and cutoffs, so for fall risks in a community dwelling older adult, the score should be less than or equal to 22 would be the cutoff, so you would want it to be higher than that, or else they would be predictive of fall risk, and less than or equal to 20 is predictive of unexplained falls within 6 months.
Hi, so today we're going to be doing the functional gait assessment. My name's Brittany, I'll be your therapist today. So I'm going to show you what we're going to do first. So the first thing we're going to do, I've marked 20 feet on the floor with tape. And what you're going to do is start right here at this mark and walk to the other mark at your normal speed. And I'll be timing you, and I'll be beside you in case you need me. And I have a gait belt on you just in case I need to grab you. Okay? So go ahead and stand at this front line for me. And whenever you're ready, go ahead. All right. Okay, so for this next test, what we're going to do is you're going to change your gait speed as we're walking in between these 2 lines. So for the first one, you're going to walk normal, and then I'm going to tell you when to speed up and when to slow down. So it'll be a couple different steps, and I'll cue you when to do both of those things. Okay. You go ahead and stand at the line here, and I'll be here to guard you. Whenever you're ready, start at your normal speed. Go fast, and go slow. And perfect. And stop. Okay, so for this next test, what we're going to do is you're going to start at this line again. You're going to walk 3 steps. You're going to turn your head to the left, walk 3 more steps to the right, and we're going to do that 4 times, so 2 times to each side. All right, go ahead and stand at this front line for me. I'll cue you when to do those head turns, and I'll be here to guard you. Ready? Go ahead. To the left, to the right, to the left, and to the right. Perfect. Alright, so for this next test, we're going to do the same thing that we just did, but instead of horizontal turns, we're going to do up and down. Okay? So same as last time, I'll tell you when to lift your head up and down. Walk at your normal speed. Whenever you're ready, go ahead. Up, down, up, down. Okay, so for this next test, we're going to have you walk at your normal speed. I'm going to show you. So we'll walk at your normal speed, and then you're going to pivot turn. Okay? So go ahead and stand at the line here. And I'll tell you when to do that turn. Okay? And I'm going to time you when we get to that turn. All right, go ahead. And turn. line here, we're going to go to the cleaning bottle right there. You're just going to do heel to toe walking. And I'm going to be beside you. Okay? So just make sure the heel touches your toe each time. Okay? So you start here. Ready, go. Lines again, but your eyes are going to be open. We're just going to walk backwards. Okay? I'll be here to guide you. Ready, go. Okay. So for this last test, what we're going to do is you're going to go up 4 steps here, and then turn and come back down those same 4 steps. So if you need to hold on to the rail, you can, but it's just going to look like this. Now you're ready?